Imagine having a fear so intense that you didn't even leave your home. You didn't want to leave your home. You stayed inside. Guys, today we're talking about agoraphobia. This is a condition that manifests as an intense fear and anxiety of being in places where it's hard to escape or where help might not be available. People with agoraphobia usually have fears that involve maybe crowded places or bridges, shopping malls, being outside alone, tight spaces, and plenty of other environments. And those with agoraphobia may and often do avoid situations that put them in distress, such as being alone outside of the home or traveling in a car or a bus or airplane if that makes them uncomfortable, being in a crowded area or enclosed spaces, crossing bridges, et cetera, et cetera. You know, this is a condition that really can impact someone's life in a major way. Psychology Today says that people with agoraphobia fear such situations because they focus on the idea that escape might be difficult in the event of an emergency, or that help might not be available if they were to develop panic-like or other embarrassing symptoms. Also, it's important to remember that the fear that people have with this condition tends to be out of proportion to what actually is really going on. Okay, so what's actually happening in real life does not typically warrant the level of fear that someone with agoraphobia has. There's a lot of discomfort and stress that often goes hand in hand with agoraphobia, and many with agoraphobia may require the presence of another person to do certain things. It's important to remember that this condition is a type of anxiety disorder. Symptoms of agoraphobia include being afraid of spending time alone, being afraid of places where escaping might be hard, or being afraid of losing control in a public place. Once again, depending on other people, as I mentioned, feeling detached or separated from others, feeling helpless, staying in the house for long periods of time. And there are other symptoms as well. And according to psychologytoday.com, I mentioned this before, but people with agoraphobia might become actually housebound for years. And even if it's not for years, agoraphobia in itself can result in impairment of relationships and really a change in someone's life who has this. Also, it's been estimated that more than 1/3 of people with agoraphobia do not leave their homes and are unable to work. Symptoms can be different for everybody, okay? Remember, this is an anxiety disorder. Some people, when their fear is manifested, might feel chest pain or a rapid heart rate. They might feel fearful, obviously, shaky. They might hyperventilate, get lightheaded, dizziness, things like that. But everybody's different, and everyone's symptoms are going to be different. What's important to remember here is that treatment is available and it is possible. Treatment often consists of a combination of therapy, cognitive behavioral therapy, and or others, medications, sometimes support groups and other modalities may be used. It's really important to get the help of a licensed psychiatrist. Work with your family doctor, your internist, your primary care doctor to help you get help through the care of a psychiatrist and a psychologist. That is very important. Regardless of whether you experience symptoms to the degree that I mentioned or to a lesser degree, it's going to be really important. Guys, let me know if you experience any symptoms like this or if you've known anyone who has or does. Just remember that treatment is possible, so have hope. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen.